First of all, I would like to ask for both your permission to use this video for educational purpose and on internet for publishing and education.
Absolutely.
Thank you. Now, tell me, what were your symptoms before the surgery?
Excruciating pain in my thighs, the backs of my legs, my knees, my hips, my lower back, everything possibly from the waist down.
Okay.
Made it impossible for me to walk any distance at all.
How bad was the pain, 1 to 10?
Well, there again, if we go 1 to 10, I would say 11.
11, okay. Now, how long did you live with that pain?
Oh, probably 4 or 5 years.
That's a very long time.
It
I
is.
mean, why did you live that long with that pain?
Because I found nobody that would help me until I was referred to you.
Okay, tell me about that referral. How did you find out about us?
Well, I had an employee that had the identical surgery, and it took a little while for him as far as going home, walking, getting exercising, and doing the things that he had to do. But he's a different person today. And I said, you know what, Les? I want what you got.
Okay, and you and I met last year.
Pardon?
You and I, we met last year.
Yes.
And we went through lots of steps, and finally we identified what the problem is. That in your case, unfortunately, you have scoliosis, you have very severe degenerative spine disease, and we said we are going to go with the first step, stage it, and fix 3 of the worst discs.
Yes.
We did that, and before the surgery, do you remember our conversation about the risk versus benefit?
Yes.
Tell me about what did I tell you about the nerve irritation, risk of nerve irritation, and the surgery, and so on and so forth?
Well, I think anytime you have any surgery at all, there's always that possibility that something could happen.
Okay.
And I was so willing to take, because of the excruciating pain, I was so willing to go through the experience.
Because you couldn't live with that pain anymore.
I couldn't live with it. No.
Okay,
It
and we
just
talked
made
about
life no fun.
Yeah. No, in this surgery, we talked about, like any other surgery, there are some risk involved, especially the risk of nerve root irritation in the leg. And the morning of the surgery, I remember you and I, we talked about that again. Do you remember that as well? And you said, go for it.
Go for it.
So what you understood what the risks are.
Yes.
And you still gave me the permission to go for it.
Absolutely.
Why did you do that? Why did you take that risk?
I just wanted a better quality life.
Okay.
I wanted to be a better husband to my wife.
Okay.
To be able to do, I'm still active, I still work.
Okay.
And so many of the things that I was doing were getting to be a challenge because of the pain that I was suffering.
No, when was the surgery?
March 8th.
So 2 days ago.
2 days ago.
2 days ago, the surgery. Now, and I understand you don't have that nerve root irritation. Fortunately, you are within those big group of people who don't have nerve root irritation. So, have you been walking okay?
I've been walking just fine.
How is the pain today?
You know, I think the pain that I have is more of a numbness and not a pain. The pain is gone.
Excellent.
And I think some of it is just getting the muscles working again. And that'll take a while. It's like when you start exercising and you're stiff for a little while. And I think that's where I'm at right now.
Okay. Now, so you have been walking, the pain is controlled, and I understand you are ready to go home just
Yes.
2 days after the surgery. This is which is a very big surgery, and I like that you have a smile, and it seems that you know that you are where you expected to be. So may I ask as well, what do you notice? What's the different? Have you noticed a different? How is he different now?
Well, I don't know. I guess I'm going to find that all out.
I like your attitude. You have a positive attitude, and that helps for the healing process. But overall, I think we are on the right path. Okay?
I think so too.
Thank you for the interview.